Okay. Hi, everybody. I'm Deedee Voisey. I'm one of your public health nurses down here at the Maniashini Clinic. I'm employed by the band. I'm here to tell you a little bit about the coronavirus or COVID-19 because I know there's been some concerns and questions from the community. COVID-19 is a virus. It's kind of similar to a cold or a flu virus, but a little bit different, if that makes any sense. The flu vaccine that we normally give every fall does not protect against the coronavirus. Pneumovax and the pneumococcal vaccines do not protect against the coronavirus either. So that's something to keep in mind, that a big rush on flu vaccines will not help protect in this particular case. What you do need to know about this virus is that it's a new one, and that's why there are health concerns right across the world, because people need to be vigilant in how they protect themselves and prevent the spread of this virus so that we can all stay healthier for a longer time. The coronavirus outbreak started in China last November. There were the initial cases, but things were kept very quiet. And here in Canada, we didn't know much about it at all until about the beginning to middle of February, when news started to make it out into the media worldwide that there was something happening in China. I'm sure people have heard about things happening in Italy as well and are noticing that there have been some changes in how things are done right across Canada at this time. The reason that I need to keep you informed is so that we don't panic. I've seen a lot of chatter on Facebook. People are getting really scared. A lot of that is because some of the news that's out there on social media is what we would call fake news and not based on good, reliable sources. So I'm going to tell you about the symptoms if you were to come in contact with this virus and get sick with it. You would experience similar symptoms that you might with any other cold or flu virus. So you might notice that you get a fever, that's a temperature higher than 38 degrees. You might have a headache, you could have a dry cough, you might feel overly tired. Some people might complain of aches and pains, they might have a runny nose, they might feel stuffed up in their sinuses, they could have a sore throat, and they could have diarrhea. Generally, when there are flu viruses, the diarrhea tends to happen in younger people more so than adults. The symptoms for this virus usually start out mild, and they can gradually worsen. The people that are most at risk, though, you must remember, are the people who have underlying health conditions. Okay, so we're talking about people that are over 65, that maybe have lung disease, diabetes, kidney disease, chronic ongoing health conditions that already put you at risk for complications of things like flus, colds, and other viruses in the environment. It's also important to remember that in the general population, about 80% of people recover fully in a fairly quick time from this virus. Some people with fever and cough may develop problems with their breathing, and those are the people that need to seek medical attention. So keep in mind, if you have a high fever and you have a cough and you develop problems with breathing, you need to contact 811 or call the ambulance and tell them what's going on. Okay, the best way to prevent the spread of the COVID-19 virus is through really good hand washing, and I'm going to explain to you right now what really good hand washing is. Okay, so when you're getting ready to wash your hands, you want to make sure that you have got soap and water, running water is preferred, and that you've got clean towels. It could be paper towels, it might be a towel that only you use, but you must have clean towels to dry your hands with afterwards. The easiest thing is probably for every person in your household to have their own towel. So to wash your hands, you're going to turn on your taps and you're going to pump some soap or grab your bar of soap. The liquid soap is a lot easier to help everybody stay clean, but if you can't get that, then use a bar of soap. Lather up your hands under the water. Okay, you're going to rub. You need to clean the back of your hands. both sides. You need to remember to clean your thumbs, both hands. You want to clean your nails. If you don't have a nail brush, just scrub your fingernails along the palms of your hands, both sides. Wash and wash every single surface of your hands with the soap for about 60 seconds. That's about how long it would take you to sing the ABCs, including the last little bit of singing along with me, at least once. You can go twice if you like. The longer you wash, the better off you are. Then when you're finished, rinse your hands under running water to wash away the germs that you've been washing onto the bubbles. Then take a clean towel or a fresh paper towel, wipe your hands, and then turn off your taps with the paper towel. That's very important. If you touch the taps again, you're going to put all the germs back onto your clean hands. Use that paper towel to open the door if you've gone to the bathroom to wash, so that you don't reinfect your hands with any germs that might be on the doorway. When do you need to wash your hands? You need to wash your hands before you eat, before you use the washroom, after you use the washroom, after handling any kind of animals, after coughing and sneezing, and any other time that they feel dirty. It's really important. If you're not sure how to get your children to wash their hands, you can put a little X on the back of their hands with a marker in the morning. And if they are washing their hands at all the times that they need to be, those X marks will be gone from the back of their hands by the time they go to bed at night. So that's a helpful tip to get you to have your kids wash their hands often. Another step in prevention is making sure that there is a good amount of house cleaning happening. I know this is going to add a lot of extra work to everybody's household chores. However, it's really, really important at this time to make sure that all high-touch surfaces in your home and in your work environment as well are cleaned several times a day, at least 2 times a day, with a disinfectant solution of some kind. You can use Lysol wipes. You can use 1 part bleach into 9 parts of water. Any of those things will help kill off any germs that might be lurking on the places that people touch. Remember, germs like to travel on hands, and the best way to protect ourselves against them is careful hand washing along with careful cleaning of high-touch areas in your homes. So what do I mean by high touch? Your telephone, your light switches, your doorknobs, the knobs on your oven, your kitchen cupboard door handles, the flush box in your toilet, all the taps in your house, whether it's your kitchen or your bathroom, anything that you see that people like to touch. Now I know lots of households have small children in them, so get down on your hands and knees and see what the small children can reach and touch, and make sure that those areas are cleaned really well as well. Okay. Wash your hands, high touch. A third way of making sure that you help prevent the spread of this virus is to practice something that we call social distancing. Social distancing means that we're avoiding contact with other people, with crowds of people. So an example of that is, come over.
Okay.
An example of social distancing would be maintaining at least a 3 to 6 foot distance between anyone that you're having contact with. So right now, Shannon's too close. Right now, Shannon is just the perfect distance away. He's at least 6 feet away from me. So this helps because if Shannon, let's say for example, Shannon had a cold and he sneezed. When he sneezes, the droplets from his sneeze will travel anywhere from 3 to 6 feet away from him if he doesn't cover his sneeze. Okay? And if that happens and he has a virus and I'm standing there talking to him, I'll breathe in that virus and I can risk getting sick. So that's why he has to stand way over there. So not only does social distancing mean that I have to stay at least 3 to 6 feet away from somebody, it also means that I need to try my best to avoid going into places where there will be lots of people. So I need to avoid going to bingo. I need to avoid going to the grocery store when there's likely to be crowds. I need to avoid public places such as movie theaters, gyms, Tim Hortons if it's crowded, say at lunchtime, any places where lots of people gather, because the likelihood, the possibility of spreading a virus is higher when there are lots of people around. So really, really important. With all the buildings down here being closed and the school being closed, it's important to remember that part of social distancing also means that you keep your family, your children in the home. Spend time together, do things together as a family. Don't be out visiting other people. Don't invite people to come over, because then you're no longer practicing social distancing. I know that's a very, very difficult thing to do. We're here in Labrador. Everyone likes to visit. We love to spend time with our extended families. At this point, for everyone's protection, it's really, really important to stay within our own households and avoid contact with people outside of our households if we are affected by all these closures, such as schools and offices. So it's also important to remember that there is a correct way to cough and sneeze. I know that sounds funny because we all just cough and sneeze, right? But it's important to remember that if we're going to prevent the spread of a virus, we need to remember to cough. We need to remember to cough or sneeze into some kind of a barrier. You can cough or sneeze into your arm. You can cough or sneeze into your sweater. You can cough or sneeze, you can cough or sneeze into a tissue. Then you fold up your tissue, throw it away into the garbage. Make sure nobody else can touch it. If you have any questions or concerns, you can call myself, Deedee Voisey, at 497-3837, or you can contact Karen Williams at 497-3833. You can call the Maniashini Clinic at 497-8202, the Labrador Health Center at 897-2000. If you have any symptoms and you need to report them, you need to contact the health line at 811. There is a self-assessment tool on the Healthline webpage. Please, if you can, see our Sheshatshiu Public Health Facebook page for links to all of the required information.